Good afternoon, everyone. Thank you for joining us for this edition of COVID and You. My name is Liz Charlotte. I'm the Director of Communications, and I'll be your facilitator for this meeting. Joining us will be State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig. So today, what I want to do is bring you up to date with the latest COVID numbers and then go over some information and some misinformation, really focusing in on the issue of vaccine trust. Then we want to talk about moving past the pandemic and what that looks like and what we need to do to achieve that. And then finally, we want to make sure that vaccine sites are where you are. If you're in a rural area, we want to make sure that you have a vaccine site that's close to you and convenient for you. And Mr. Jim Craig will talk about that. So right now, Dr. Dobbs, would you talk to us a little bit about the trust issues with the vaccine?
Yes, absolutely. So, Liz, thank you, and thank you everybody for joining us. I'm going to go ahead. Yeah, so I'm going to share my screen. I want to go over some basic information about COVID vaccine and COVID. You know, there's been unfortunately a lot of misinformation and disinformation about the COVID vaccine, and I want to really use this as an opportunity to share some important messages, but also to open it up to questions, so that people can ask the questions that they want to ask to understand what really is the truth about the COVID vaccine. First off, I think it's important, let's talk about what is the coronavirus itself. What is COVID? COVID is a virus, and in this depiction, you can see that it has the spike protein on the outside, which is very important in our story for COVID. And on the inside, it has this segment of RNA, or ribonucleic acid, that is the genetic code that helps produce more coronaviruses. And the coronavirus COVID uses this spike protein to access the human cell through this ACE2 receptor. And then after it does so, it's able to inject its viral RNA into your cells, and it uses this RNA to then reproduce itself. It basically takes over your body's own machinery to reproduce itself and produce the proteins that will help it make new viruses that can then leave the cell and infect other cells, but also infect other people. Let's jump on to how does the immune system work when it comes to COVID. We know that when someone is exposed to a germ, that they can become very ill. That's because you have inflammation as the body tries to fight off the germ. You can have tissue damage. You can have immune responses to the germ that can be harmful. And over time, hopefully, if someone doesn't get sick enough to die, the immune system will identify this as a foreign invader and basically coalesce the troops to make sure they can eradicate it. The two big parts of the immune system that we commonly discuss are the B cells, which produce antibodies, and T cells, which basically help support the antibody production, but also help clean out the infected cells so that you can sort of take those virus factors out of operation. And then after the infection is cleared, your body will save a subset of these cells as immune cells, so that if you're exposed later on, then you can eradicate it before you get sick. The good thing about the vaccine is it trains our immune cells to identify this foreign invader, generate these memory immune cells, such that if we are exposed, we can avoid all of this illness phase that we might have seen, with the infection itself. So that once we're exposed to the germ the next time, the immune cells, these memory cells, will wake up and will eradicate the infection before we have any illness or can infect other people. I do want to make a quick sort of divert a little bit to talk a little bit about what is RNA, and let's just go back to our biology class and what is RNA. RNA is a normal component of our body and our cells. And basically what messenger RNA is, if we have DNA, which is our genetic code, correct, then our cells will make a copy of this into what we call messenger RNA. And this messenger RNA then goes down into the outside portions of the cell and is translated, right, into protein. So this is basically how the body uses genetic information. It's basically the messenger that helps your body make proteins, which are basically the tiny little machines or little workers of your body, like hemoglobin or albumin or whatever. This is how your body makes proteins. And if we think about how does the Pfizer and the Moderna vaccines work, how do they work? Well, it's actually pretty elegant and brilliant. And so what they've done is they have created a vaccine that uses a small ball of fat, just a little of fatty molecules that are normal, benign fatty molecules, and they put in a little bit of the messenger RNA that produces the spike protein, right? So not the entire virus, but just that one little spike protein, so that your body can generate an immune response and recognize an invader when you're exposed to it. It will develop a good both B cell and T cell response so that you have a holistic immune response if you're exposed. The RNA will be produced, in the area of the injection when you get the shot, and your body will chew it up. Your body is very used to dealing with RNA, and it will just degrade it after it's done using it to generate this immune response. So basically, it just teaches your body how to recognize the spike protein as a foreign invader. And if we jump down to the viral vector vaccines like the Johnson & Johnson, basically, instead of using the little fat ball, they use the shell of a benign cold virus to introduce a small section of the spike protein DNA, so that you can basically have the same effect. They have different profiles. We know that if you get Pfizer, Moderna, you have to have 2 shots versus 1 for Johnson & Johnson. But we know that the Pfizer, Moderna are better at preventing any symptomatic illness, but Johnson & Johnson's pretty good with its 1 shot. But when it comes to preventing severe illness, hospitalization, or death, they both are very good and often approaching 100% in studies. So these are very, very effective vaccines. We know that any medication or vaccine can have some side effects. If you get the COVID vaccine, many, if not most people, have 0 side effects, except for some soreness maybe at the injection site. The primary things that people might have is a little bit of achiness or fatigue 12 to 24 hours, kind of after they've had the shot, but this is temporary. This is just your body's immune system learning how to recognize and fight off COVID. And then once you've sort of logged that memory, this little inflammatory symptoms resolve. This can be a little bit worse after the second shot as your immune system is getting further primed, but it also can be a little bit more intense in those who've had COVID before, because again, your body's immune response is the thing that makes people feel that way. Now, there are things that can happen that can be worrisome. Very rarely we have anaphylaxis or a severe allergic reaction in about 2 per million. So it's very, very uncommon, but this is primarily among those with known anaphylaxis to medications, and thus far have been made aware of 0 deaths from this. It's just something that has to be managed. And also we have this very rare autoimmune blood clot situation, and I'll talk about that briefly. If we look at where people have been vaccinated in the United States, you can see that we're a little bit behind for the total number of people receiving first doses or fully vaccinated in the Southeast, especially sort of like in the heart of the South. And again, we're right smack dab in the middle of it. And we also have some variability in the state of Mississippi, and all this information here is available on our website. And you can see that the leader is going to be Madison County, with variability depending on where you live, and encourage you to look and see where your county is and do whatever you can to support in messaging and your community to get folks protected as quickly as possible. So why take the COVID vaccine? Well, if you are 50 or older and have medical issues, there is a very significant risk of death or hospitalization. And we know that if we look back at the numbers, and this is a little bit older slide, but about 1 in 10 people who are diagnosed with COVID over 65 will go on to die. And that doesn't even speak to the number of people who are going to be hospitalized. You can see that it's going to be around 2% of people who are 50 to 64 who are going to die. That doesn't even mention the people who are going to be hospitalized and have a severe hospital illness. But even for people in this 25 to 39 age group, we're seeing about 2 deaths per 1,000, which is going to be relatively small in your odds. But if we compare this with other illnesses like flu, it's very, very high. And if we compare it to the side effects of the vaccine, the risk of death, even for young, healthy people, is far higher than any significant risk from vaccines that we've seen so far. But if you're young and healthy, why would you get vaccinated? Well, we know there's a smaller risk of death and hospitalization, so it's going to protect you from that. But also, too, it can prevent COVID, because COVID can make people feel really crummy, really sick, even if it doesn't make you go in the hospital or kill you. Protect your family. This is going to be one of the most important things, because we know most people who catch COVID catch it from their family or the people they love. You can avoid quarantine if you're exposed in a public setting. You can stop transmission in your community, and you can prevent long COVID. We know that a large percentage of people actually have symptoms well beyond the COVID period. And there actually are even people or a lot of folks who have long COVID, even though they had asymptomatic illness. So the best way to prevent all of these things, no matter your age group, is to get vaccinated with these highly effective vaccines. There are some myths that we need to counter. You know, some of the stuff that's circulating out there is COVID has killed a bunch of older people. This is absolutely not true. You know, we have had people who've died sort of coincidentally at a time near when they've had their COVID vaccine, but this has been studied extensively. If you focus on giving vaccine to the oldest people, the people who have chronic medical issues, of course, some of those folks in the course of their normal sort of life course are going to have something happen, like a heart attack or stroke or something that's going to be a normal thing that they might have had otherwise. So it is not killing anybody like it's been purported. COVID vaccine can cause infertility. Again, not true. ACOG has come out strongly that this is unfounded and there is nothing to this. It does not cause infertility. Microchips, again, false. That's kind of one of the more colorful ones, but does not have any sort of micro technology like microchips or any sort of tracking devices. COVID vaccine was developed too fast. All of the steps were followed, but they just had the sort of really sort of brilliant idea of doing two things. Instead of doing things in sequence, they did things at the same time, like the research and the production, and they did away with bureaucracy by prioritizing this review and making sure that anything that was unnecessary, anything that was basically what we consider as normal government bureaucracy, was sort of set aside to make sure that the same thorough review is done without any unnecessary impediments. And also another one is mRNA will change your genes. Again, entirely not true. You know, we reviewed how mRNA works a minute ago. Your body processes mRNA all the time. Your cells, process it every single day. So it will not change your genes. Again, that's absolute made up nonsense. And a lot of people are wanting to say, well, I'll just wait and see what happens to other folks. Now's the time to get it. Now's the time where we can keep COVID out of our communities. We can prevent the emergence of these dangerous variants. And the risk is going to be, right now, right? We've given, close to 200 million doses of COVID vaccine, right? How much longer would you want to wait before you get the benefit for you and your family? So now really needs to be the time if you have not been vaccinated yet. There is this rare blood clotting disorder that we've seen with Johnson & Johnson. It's referred to as thrombosis with thrombocytopenia syndrome. Again, very rare, about 1.9 per million, primarily in women under 50. And actually most of the women were going to be between 30 and 39. It is a serious thing. And if someone has severe headache or severe abdominal pain following Johnson & Johnson, they should seek treatment. But, we do have it available right now in the state of Mississippi, but we also want to make sure that if people want to get Johnson & Johnson, that they are informed about this very small, very, very unlikely thing to happen, and they can make that choice. We do have highly effective Pfizer and Moderna readily available throughout the state. But we know that the risk from Johnson & Johnson is extremely low. And especially if you're a younger woman, you want to consider getting another one, great, that makes sense. But we also know a lot of people want to use Johnson & Johnson, and we fully endorse that as an option for people to take to protect them from COVID. And Liz, that's all I have right now. Thank you.
Dr. Dobbs, could you talk a little bit, and I'm sorry to interrupt you, could you talk a little bit about how this is not a political issue, it is a public health issue?
Yeah, no, yeah, of course. That's one of the things that's been really sort of difficult is this is not a political issue. This is a scientific issue. This is a virus. This is a virus that makes people sick, and it's a virus that kills people. It's very easy to put this within the lane of scientific research, treatment, and response. And at the Mississippi State Department of Health, we strive to stay within the lane of science and give to everybody straight. So please know this isn't a political issue. This is a health issue.
Thank you, Dr. Dobbs. Dr. Byers, can you talk to us about the current situation and how we can move past this pandemic?
Absolutely. Thank y'all. And I'm going to share my screen just a little bit as well and show a couple of slides. And, Dr. Dobbs already covered a good bit of information about why it's important to get vaccination. I want to talk to you about where we are right now with our overall epidemiology around COVID-19, as well as to provide you a little bit of information on where we are with our vaccination efforts and what some of the other benefits of vaccination are and how we move forward. I think it's going to be important for everybody to understand that right now, at this point in time, that vaccination is our best protection and our best foot forward to getting back to normalcy. If we can get vaccinated and follow the guidelines at this point, we have an opportunity to continue to reduce the number of cases that we're seeing in the state, as well as the impact. Right now, today, we're reporting out 208 additional cases and an additional 14 deaths. As you can see, over time, in the last several weeks, our overall case numbers have continued to decline. We are now at a 7-day average of about 228 cases a day. And really, if we look back over the last month since the first part of April, we're averaging between 200 and 250 cases a day, which is a significant improvement over where we were just a few months ago over the holidays. When we look at our overall deaths, we continue to see the same trends. We continue to have some declines in our deaths, which has been remarkable, and we've been very relieved to see this. Right now, we're reporting out an additional 14 deaths that were just reported to us yesterday. But when we look at our daily deaths, we are averaging between 4 and 5 deaths a day, and we have been for about the last month or so with our 7-day average. Now, we are still seeing a much smaller impact on our nursing home and long-term care settings. We are at a little bit over 20 outbreaks reported in those settings now, but the impact has been drastically reduced, large in part due to vaccination efforts to get the residents protected in those very high risk and protect that vulnerable population. And you can see in the red, which denotes the the deaths that have occurred in long-term care residents. On this chart, you can see that we've had some significant improvements and reduction in deaths that are occurring in those long-term care settings among residents, with the last death that we had reported in a long-term care resident occurring in mid-April. As Dr. Dobbs illustrated, we are seeing the highest risk and the highest impact on individuals who are 65 and older, but also those individuals at any age who have underlying health care problems or health conditions that put them at risk of having severe outcomes as a result of COVID infection. If we look at where we are with our vaccination efforts now, and we've vaccinated or administered more than 1.7 million doses in the state. More than 950,000 individuals have been vaccinated with at least one dose. That's going to be one dose of the Johnson & Johnson vaccine or at least one dose of the Pfizer or Moderna. And we have over 800,000 Mississippians who have been fully vaccinated in the state. When you look at that, that translates to about 30% of our population have at least had one dose, and about 25% of our population have had full vaccination. And full vaccination is basically 2 weeks or more after you've completed that last dose in the series. So if it's the 2-dose series, if it's the Johnson & Johnson or the 2-dose series of Pfizer or Moderna, and you get both doses 2 weeks after that, you're fully vaccinated. For the 1-dose series, which is the Johnson & Johnson vaccine, 2 weeks after that dose, you're considered fully vaccinated, and you have reached the benefits of that full vaccination and protection now. When we look at some of our more vulnerable populations, and when we look at those individuals who are 65 and older, which are really a group of folks that we want to make sure that we protect, we have achieved more than 70% of folks in the state who are 65 and older have received at least one dose of vaccine. And this is big. This is going to be the kind of thing that pays those dividends for us down the road, that if we do start to see some increases in our case numbers, that's really going to blunt the effect. It's really going to reduce the impact of severe illness, of hospitalizations, of deaths. All of these things can be accomplished through vaccinations. Protect our healthcare system and make it so that the people who are really sick have a place to go in the hospital and have an ICU bed and have a ventilator if they need it. And so all of those are some of the things that we can do with the vaccine, and really why it's important. Because remember, the vaccine, and Dr. Dobbs showed you the effectiveness of the vaccines at preventing illness. But even under those circumstances, it really has a benefit of preventing those severe complications that can occur as a result of infection as well. And so you really almost get a double protection. You get a protection against infection. And if you do become infected, the symptoms are much less, and you have a much less severe illness with a much less risk of developing those severe complications that put you in the hospital. And that's across age groups. And so that's very important, especially as we see variants emerging in the state and in the US. And, we are starting to see an increased number of COVID-19 variants that have been identified in the state. And it's going to be important for us to not only make sure that people get vaccinated, but if you're a 2-dose series and you've gotten the Pfizer or the Moderna, to make sure that you complete that full vaccination. That's where you really get the benefit. And so it's important, if some of y'all are out there who've gotten at least 1 dose of Pfizer or Moderna, and you're past the time, it's not too late. Go ahead and get your vaccination. When we look at some of the other benefits of vaccine, and CDC is continuing to evolve their recommendations for individuals who are fully vaccinated. And there's a lot more that you can do now if you're fully vaccinated. You can gather indoors with other people who are fully vaccinated without having to wear a mask or without having to stay 6 feet apart. You can gather indoors with unvaccinated people of any age from one household. So that means if you've got relatives from one household, you can visit with them without a mask or without staying 6 feet apart, unless there's an individual within that group that you're visiting with who's at higher risk because of their age or an underlying health problem, or if someone that you're visiting with lives with a person at higher risk. So it's still important to think about it and make sure that you are taking some precautions, even if you're fully vaccinated. But you can gather for outdoor activities without wearing a mask, unless you're in a really crowded setting or venue. You can travel in the US without getting tested before you travel, and without having to self-quarantine after you travel. And as Dr. Dobbs mentioned, if you are around someone or exposed to someone with COVID-19 and you've been fully vaccinated, you don't have to quarantine or stay away from others, and you don't have to get tested unless you have symptoms. So those are some of the benefits, but the real benefit is you prevent infection in yourself, but you also prevent transmitting it to other people. Obviously, we are still seeing cases in the state, and we've known from our own personal experience with dealing with this now for more than 12 months, is that we can see increases in cases. And vaccination is really the way forward for us to continue to keep those case numbers down, to keep the impact down, and to continue to maintain the capacity in our healthcare system, and really, guys, to save lives. And that's what we're doing right now. So Dr. Dobbs and Liz, that's what I had. And I will turn it back over to y'all.
Thank you, Dr. Byers. What would you say to someone who said, oh, your cases seem rather low, outbreaks are low. Why should I take the vaccine?
Well, we've been in this position before. We've seen where cases have been low before. We've seen where outbreaks have been low before. And when people start interacting that are unvaccinated, we can see some increased cases again. And so even though we're low, we're not out of it yet. We're in a better position than we were a few months ago, even before we started with the vaccination efforts. I think the vaccination efforts that we've had have been what's made a big difference in our overall case numbers in our overall deaths. And I think, we're not at the point yet where we can completely stop. We need to continue to get vaccinations rolled out. Every individual that gets a vaccine in the state is protecting themselves and protecting those folks around them. So now's not the time to let the foot off the gas. If you've been on the fence, now's the time to get the vaccine.
Thank you, Dr. Byers. And talking about testing and vaccine, those opportunities are available throughout the state, not just with us. We have providers and pharmacies, and we have Mr. Jim Craig, who has been coordinating this phenomenal effort, to talk a little bit about that. Jim?
No, thanks, Liz. And yes, it's really important, I think, for people to know that testing capability is still available throughout the state of Mississippi. You can be tested for COVID-19 by many local medical providers statewide or at free testing sites. University of Mississippi Medical Center has been a great partner in this response for both our testing and our vaccination scheduling systems. And they have a website, covidschedule.umc.edu, that if someone is symptomatic or meets the other screening criteria, they can go and find locations in addition to local providers that provide testing. We do still operate the Capital City testing location here in Jackson at the old farmers market 6 days a week, Monday through Saturday. But there are other locations where the health department and other healthcare providers provide testing around the state. Just remember that if you are symptomatic for COVID-19, that you isolate yourself while you wait for those test results to come back. If you have a sample taken at one of our locations or one of these medical providers, it's essential that you remain at home and away from other family members as much as possible until you get the results to prevent the spread of the virus. On the vaccine front, we have a number of opportunities for vaccine in the state. I'm going to share a screen of just a little bit of that. Let's see. We see the screen okay? All right. So if we look at our state drive-through locations around the state, you'll notice up in DeSoto County, we're at the Landers Center. In Panola County, we're at their Civic Center in Batesville. Over in Lafayette, we're at the Readiness Center, which is a National Guard Readiness Center right next to the Oxford Conference Center. In Lee County, we're at the Barnes Crossing Mall at the old Sears store in their parking lot right outside that store. In LaFleur County, we're at the Floorwood State Park. In Washington County, we're at their Coliseum. Over in Noctibaha and Starkville, we're at Mississippi State University's Mississippi Horse Park. And over in Lowndes County, we partnered with Fairview Baptist Church, so a very large church there in Columbus, Mississippi, and that is the location there. In Madison County, we're at the Canton High School. In Hinds County, at Smith-Will Stadium, and over in Rankin County at Trustmark Park. In Neshoba County, we're at their Coliseum. And over in Lauderdale County, we're at the Lauderdale County Health Department in Meridian. Over in Adams County, they have a tornado safe room. We operate out of that safe room in Natchez. And down in Pike County in the Macomb area, at the Edgewood Mall outside the old Goodies store. Over in Jones County, we operate at the Magnolia Center, and in Forest County at the Lake Terrace Convention Center. Down in Harrison County, we have a drive-through, actually drives into the Mississippi Coast Coliseum in Biloxi, and over in Jackson County, we're at their fairgrounds. Each of these state drive-through sites, appointments can be made at COVID schedule or covidvaccine.umc.edu. There are also some additional county drive-through vaccination sites that service state appointments from that system. Over in Bolivar County, our partners at Delta State University operate a drive-through location on Fridays. In Warren County at the Vicksburg Mall, they operate currently Monday, Wednesday, and Fridays. And at the Sharkey-Essequina County at the old National Guard Armory on Thursdays. Holmes County is operating at their old train depot. They've paused this week, but they'll be back in operation. And then in Claiborne County, we partner with Alcorn University, and they provide vaccination opportunities on Tuesday. So these are some of the locations that are available for vaccination through the state scheduling system. We also have what we call our pop-up sites. These are locations where you can sign up and make an appointment so that you know vaccines there for the time that you're going to be arriving to get the shot, or you can just show up, no appointments necessary. Appointments again can be made for our pop-up sites by visiting the covidvaccine.umc.edu, or as I said, walk-ins are definitely welcome. If we look at our upcoming locations for pop-ups right now in Coahoma County, up in the District 1 area you see on the map, we're there this week, today and tomorrow from 9 a.m. to 3 p.m. And then we'll be there on Wednesday and Saturday from 9 o'clock to noon. Over in Quitman County, over in Marks, Mississippi, we're also there today and again tomorrow. Today and tomorrow from 9 to 3, and then on Wednesday and Friday from 9 a.m. to noon. And then next week, we'll be in Yazoo County down here in the District 5 area. Again, bringing vaccine to that area Wednesday and Thursday of next week, as well as Friday and Saturday for half days. So more pop-up locations will be coming up as we look at areas of the state that have some of the lower vaccination rates, especially in the rural parts of the state, and trying to bring those opportunities closer to where people live. Our health equity unit is also working with a lot of church groups and other groups around the state to, again, assemble folks that are interested in being vaccinated, and for us to come and service those appointments and get people vaccinated with our partners. So we're working with local emergency managers, local county officials, mayors, churches, most everyone we can, to try to find these opportunities to bring vaccination closer and closer to Mississippians. So if you're interested in having a vaccination event near you, please reach out and let us know. We're happy to get something set up to bring vaccination toward you. So Liz, that's the update for vaccination and testing for now. I'm happy to answer any questions when we get to that time.
Well, I think we are at that time, and I will start with the first question from Brother Rob. Has the media and scientific community caught up with the health department's assessment that herd immunity is not achievable? What does this mean in practical terms? Dr. Byers, you want to start?
Well, certainly I can start, and I'd love for Dr. Dobbs to weigh in as well. I think that when we think about herd immunity for COVID-19, I think it's important to understand that the more people that we get vaccinated, the bigger chance we have to have a reduction in transmission. We may still see some cases, but we won't see that sustained ongoing transmission that we've seen in some of the very large surges that have occurred over the last year. And I think what's been demonstrated in long-term care settings is a good illustration, where in some facilities we've achieved more than 70% of the residents that have been vaccinated, and in some cases 30 to 40% or more of employees who've been vaccinated. And what we've seen is, although there may be cases introduced, we won't see the continued sort of sustained transmission that we've seen, very similar in the early part of the pandemic and through some of our surges, where we were seeing high numbers of cases in long-term care settings. And I think that that's almost a microcosm of what can be achieved once you get a high number of people vaccinated. And the more people that you can get vaccinated, the fewer number of susceptible people that you have. So you may see some limited transmission, but you really won't see that ongoing sustained transmission. I'll let Dr. Dobbs jump in as well and give his thoughts.
No, thanks, Dr. Byers. And I agree entirely. You know, this is nothing really new in the infectious disease community in which we operate. We identify and understand that, herd immunity, as far as like keeping all disease out, is not likely with coronavirus for a host of factors. But what we will see is if we can get enough folks vaccinated, we won't see outbreaks. We'll prevent death. it'll be a way for us to have those big goals. But as far as us having sort of like measles type herd immunity, I don't want people to have the wrong expectations that if we get 90% of people vaccinated, we will never see another case of coronavirus. I don't think that's likely. But what we might do is if we have most people vaccinated, we may never have a significant nursing home outbreak. We may never have, threaten our health system like we have before. I don't think that would be likely. So the benefits for getting as many people vaccinated as possible, it's hard to overstate.
Thank you, Dr. Dobbs. Brother Rob has another question. If kids don't get vaccinated at significant rates, are we looking at mass distancing and disruptive quarantines again next school year? Is a regular school year an incentive for parents?
Yeah, I think so. I mean, this is one of those things where the fate's in our hands. And if people want to not have kids with masks in the fall, and if they don't want to have quarantine, then we need to get as many people vaccinated as possible. I'm not saying there won't ever be a quarantine school, there won't ever be an outbreak, but if we don't want to have to do these sort of, more draconian measures that we've had to go through, then let's take our fate in our hands. Let's get vaccinated. Let's cut this out. Let's educate our kids. Let's, visit our family. It's the choice is really it's up to us, and those of us who haven't been vaccinated yet, please step up and go ahead and make it happen.
Thank you, Dr. Dobbs. Kobe Vance, reports say Pfizer plans to file for full FDA approval of their vaccine at the end of the month. Could this be a big shift for vaccine trust? Many have based their concerns on the vaccine using emergency approval, which you have stated goes through the same process. Dr. Dobbs, would you like to take that?
Yeah, sure. It's another formal step that probably won't really add any more data than we have right now. It's just another level of review. If it gives people a sense of confidence, I welcome it. I'm really glad that they're pursuing that step. It doesn't, the data's there, the studies are there, the safety information's there, and now we've given almost 200 million doses. So yeah, I welcome that as an opportunity to give additional people additional level of comfort, but it doesn't really alter my enthusiasm.
Dr. Byers, would you like to add anything?
No, I agree with Dr. Dobbs. I mean, all of the vaccines have gone through a pretty rigorous process to provide the emergency use authorization. Although this is a formal approval, which is encouraging, and I think it backs up that the data is there and has been shown to be effective and a safe vaccine. We've had confidence in the vaccine, and I think that's why we have really rolled it out successfully.
Thank you, Dr. Byers. JR is asking, I recently read that a study from MIT has described COVID as a vascular illness. Can you speak to that, gentlemen?
Yeah, we talked about earlier about the ACE2 receptor, right? So where are those receptors? A lot of them are on the inside of your blood vessels. So so it's not surprising when we see a lot of vascular complications with COVID. We see, blood clots, we see arterial clots, we see, basically occluded blood vessels with coronavirus. It's been a clinical manifestation of the disease since the beginning. So yes, I think that's a very appropriate characterization that COVID's not just a lung infection, it's a whole body infection, and it does have a severe impact on our vasculature.
And symptoms can last a long time, true?
Yeah, and even people can have late sequelae with blood clots from COVID. So we talked a little bit about the thrombotic thing with the Johnson & Johnson, which again is extremely rare. The risk of those sorts of things with COVID is way higher. COVID causes that sort of stuff a lot. So COVID's bad news. We want to, we don't want people to get it if we can help it.
All right, now the next question. Do you have a response to popular podcast host Joe Rogan, who got national attention for advising against healthy 20-year-olds getting vaccinated? I don't know if any of you saw that. Dr. Fauci disagreed. Are you familiar with the podcast?
Is he a physician? Is he an infectious disease specialist, or is he just a podcast?
No, I believe he's a podcaster.
I mean, he's just a normal naysayer, I guess. I mean, other than I'd say, listen to Dr. Fauci.
Yeah, listen to Dr. Fauci and the scientific officials, so we don't get misinformation out there. And I think it's hard to talk about this anyway, since none of us saw the podcast. Courtney Ann is asking, with the latest developments that Pfizer may soon be approved for use in 12 to 15-year-olds, what kind of impact could that have on vaccination rates for the state? Also, are there any discussions about involving middle and high schools in vaccination events if the clearance is given before the school year ends? Why don't we talk first about the approval for 12 to 15-year-olds? Dr. Dobbs?
Yeah, I think we're going to see it with the Pfizer in the near future. It's something we've been preparing for. We look forward to being able to protect an additional group of folks, and I'll let Dr. Byers give you his predictions on the impact on our immunization rate.
Well, I think, we have to have that approval sometime in mid-May. So we're coming up on that pretty quickly. And I think that, we will see some uptake. And I think, we've got somewhere in the range of 160,000 or more kids that fall into those age groups. And, we want to get as many of them vaccinated as we can. And we hope that we will see some higher demand and that we will see an uptake in those age groups. It's hard to predict exactly how, but I think that there are probably many parents that are waiting for that to come out and are anxious to get their children vaccinated. And certainly we will accommodate that. I think that, certainly we've had some discussions with involving middle and high school into vaccination events. And that's something that we're going to encourage providers to do, as well as we're, still working on formulating plans on how we do that before the school ends, if in fact we do get that EUA that comes out. And certainly, that it won't stop after school ends. We've got the whole summer to work through to get children in that age group vaccinated. So, and this is all in preparation for being able to go back to a more normal school year as well. And the more children and teachers and staff and employees in school settings that we get vaccinated, the less impact it will have on them.
Thank you, Dr. Byers. Mr. Jim Craig, what do you think, as you're the one that sets up a lot of our vaccine events, what would you think about Courtney's question about involving middle and high school in vaccination events? Can you picture that?
Yeah, we've had great partnerships with so many folks in Mississippi and trying to put vaccine opportunities together. I can't help but believe that the middle and high schools would be a great partners for us, as well as other vaccinating groups that we have around the state in trying to help us get vaccine available close to where the need is.
Thank you. Michelle Milner is asking, is there any evidence that the virus could be cyclical and surge again in the fall and winter months? We hope not. Dr. Byers, you want to start?
Well, I think the best way to ensure that we don't see it surge again in the fall and winter months is for everybody to get vaccinated now. And, as Dr. Dobbs always likes to talk about, the first three answers when you talk about COVID are vaccination, vaccination, vaccination. And I think that's going to be the key to us moving forward. There may be some seasonality with COVID. Certainly we see that with many coronaviruses that are out there that lead to the common cold. I think it's a little bit early for us to predict if we're going to see it just based on it being fall or winter. But certainly we know that that's typically when more people are gathering indoors and when there's a possibility of more transmission. But the way that we safeguard against that is if we all get vaccinated now.
Dr. Dobbs, did you want to add anything?
No, I agree. I mean, just now's the time. So please step up and get vaccinated.
Beverly is asking, is it correct to say that hospitals, clinical settings, and churches still need to follow the CDC guidelines, even though mandates have been lifted? Dr. Dobbs, why don't you start?
Yeah, no, absolutely. There's a difference between what you should be doing and what you have to do. And, to be prudent to protect folks, you should follow CDC guidelines. Now, we still have guidance on our web, from the Department of Health, that if you're 65 and older, have chronic issues, you shouldn't go to church until you get vaccinated. I mean, that's the safest thing to do, or at least go to in-person church, right? And we also have some guidance on safer ways to do worship services. CDC has compiled a great list of resources for people to do things safer in every scenario. But like we said, the first three answers to every question is get vaccinated. It makes everything so much easier and safer. It makes everything possible right now. So, just that, please.
Okay, thank you. Brother Rob is asking, is it possible to get an optional vaccination question on the weekly self-report that K through 12 schools complete to indicate the percentage of their teacher staff who have been vaccinated? At the school I teach at, I think we're almost all vaccinated, and we'd sure love to be able to brag about that. So you should brag about that. I could also see this information being useful for parents and encouraging them to get their kids vaccinated, and low teacher vaccination numbers could also indicate opportunities for vaccine clinics at certain schools. So let's start out with, could that be possibly put on the report, Dr. Byers?
I think that's a great idea, Brother Rob, and certainly we can look at that and see what that can be done. I applaud y'all on y'all's efforts to get staff vaccinated, and hopefully that includes some of the students that are eligible as well. Yeah, we love to collect that information and share that information. So stay tuned. We'll work on seeing if we can add that to our survey and what we report.
And could we use that data to then open up opportunities for vaccine clinics at certain schools?
Certainly, we could look at it, and that may be a starting point for us to determine where some of our lower vaccination rates are. But we also want to encourage the schools that, regardless of your vaccination rates that you have right now, that all teachers are eligible, all students who are 16 years and old are eligible, employees and staff are eligible. There's lots of mechanisms to get vaccinated. So don't wait for that. There are lots of opportunities now as well.
Thank you, Dr. Byers. From Courtney, Dr. Dobbs, you referenced getting back to normal, including a mask-free Mississippi in your tweet this morning. How far off do you foresee that being? You're going to have to get out that crystal ball. What factors will impact the path to that? That's what we all want to know. When can we truly be mask-free? Dr. Dobbs, I think you're muted.
Yeah, we're getting gradually closer. But I think the situation in India is very instructive and sad and tragic. But what's driving their problems and even their new variant emergent is it's not pressure because they've been vaccinated. It's because they're unvaccinated and they're spreading disease and mutants are forming. And if we can get ahead of this by having an immune population, variants can't get a foothold. So I think the capacity for us to get there and get there quickly has to do with how many folks we can get protected. I'm just really hopeful that we hit July, we can be saying, okay, let's just do normal stuff. There might be some small restrictions like wearing a mask on an airplane or something like that. That makes a lot of sense. But if we can ramp up a little bit, get the vast majority of our vulnerable folks vaccinated and a significant majority of everybody else protected, then we're not going to have masks on. But we got a little ways to go from there. And again, this is, the fate is in our hands.
Thank you, Dr. Dobbs. I've heard people actually talking about this. What are some good incentives to get young, healthy people vaccinated when that opens up? I've seen shots, quotation, of liquor for COVID shots, Krispy Kreme offers, and a minor controversy with a professor offering extra credit. West Virginia is paying young people $100 to take the vaccine. Who to give that to? Which one of you want to take that?
We've talked about it, about incentives and stuff. And we've also talked about maybe we don't want to promote Krispy well, not the Krispy Kremes are delicious, don't get me wrong, but healthy lifestyles, whether it's alcohol or fast food or whatever. Um, but yeah, no, we're talking about that, especially for some sort of high risk folks. But right now we're just trying to make it as easy as possible and make sure people have the best information. Private businesses have been using incentives, and we're very happy for them to do that. We don't know that we can actually have the permission to use that in our grant funding. But I know private businesses have been doing it very successfully, and I think that's a fantastic thing.
Thank you, Dr. Dobbs. Anita Lee is asking, how strong is vaccine hesitancy, which we like to say confidence, at this point, based on appointment uptake and other measures you're using? And it's important to remember there's a lot of other providers out there besides us. Who wants to take this?
I can cover a little bit of it. Our first dose appointment numbers have softened a little bit in our drive-through locations, both at the state and county level. But this week we crossed over 1 million appointments in our state system being made for state vaccination, and we're still seeing about 2,500 to 3,000 a day being made. So I think there is some hesitancy there. I think the reason that the pop-ups are becoming more and more popular is it is time for us to get closer and closer to where people live in Mississippi with vaccine and make those opportunities available closer to where people work and play. So I think we'll see some increase in vaccination because of those efforts. I'm very hopeful anyway.
Thank you, Jim. Gentlemen, Dr. Byers, Dr. Dobbs, did you want to add anything?
The only thing I'll say is what there is an abundant information on is there are a lot of folks who are open to getting the vaccine, but just haven't done it yet, right? We've got a lot of people sitting on the bench. There's a small number of folks who are, just actively deciding that they don't want it. But there's a large number of folks that would make all the difference. Just say, okay, it's time for me to get off the bench and go play. We need those folks to get off the bench. We need you to contribute. We need you to help your community go ahead and get going. Because there's a lot of people who are just kind of just playing a waiting game. What it looks like is that everyone's either going to get the vaccine or COVID, right? And under every scenario, the COVID vaccine is going to be thousands of times, if not 1 million times safer than getting COVID, right? We're talking, there really should be no decision algorithm that doesn't say, I want the COVID vaccine as soon as possible. So we want to get those folks off the bench.
And if I can add, if it's a convenience piece too, and certainly that may be part of it for some people, is that, vaccine and opportunities to get vaccinated are more and more available across the state. And, we have now on our website a vaccine finder where you can, look at a state map of Mississippi, and there's a placeholder for every provider, either a physician or a hospital or a retail pharmacy, or one of our pop-up clinics or one of our drive-through sites. And those are reflected on that map, and you can find a place near you to get vaccinated. So, and it hopefully will be just a short drive and an easy trip.
Thank you, Dr. Byers. A growing number of parents appear to be advocating on social media for mask choice for students in the 2021-2022 school year. If vaccines are only approved for 12 years and older, do you anticipate there will be a continued need when they return for the next school year? Dr. Dobbs?
I would say I hope not. I think it would be our goal and our anticipation that we could get kids back to school mask-free in the fall. One of the reasons why it's so important right now is no kids can be protected with a vaccine. And so that's really a vulnerable population. We already can do 16 and older. We'll probably add 12 to 16, and then would likely add younger and younger age groups going through the summer. So I do think that's going to be a possibility. But the other thing is if we have all of the age groups, older than K-12 kids who are immune, that changes the dynamic. The risk determination, both for outbreaks and also bad outcomes, is very different. We all help out each other when we get immune at any age group.
Dr. Byers, have we checked lately on the breakthrough numbers? Breakthrough
Yeah,
cases? Yes.
doing surveillance for breakthrough cases is one of those things that we are doing right now ongoing. And, we've identified a little bit more than 150, I think maybe 155 cases of vaccine breakthrough infection that have been reported to us in the state. And just to kind of put your mind around what that means, and that's individuals who've been fully vaccinated. So they're that 2 weeks or more past their last dose in that series, who then test positive for the infection. So not all of those individuals are going to be symptomatic, but we have identified about 155, 154 breakthrough cases in the state. And we've seen 3 deaths, I believe, among those individuals so far. But to keep that in perspective, we have now provided more than 970,000 individuals in Mississippi have gotten at least one dose. More than 740,000 Mississippians have completed vaccination. It's way more than that now. And of that, we've identified about 150 cases of breakthrough infection. So I think I may have lowballed the number of people who've been fully vaccinated, but you can understand where we stand with that.
Thank you, Dr. Byers. Okay, not much masking at the local gas stations these days. Do I assume everyone's been vaccinated, or still everyone has COVID? Definitely you can't assume everyone has been vaccinated. Dr. Dobbs, you're smiling?
Yeah, I would love to assume everybody's been vaccinated, but we know they haven't. Outdoors, we do feel like COVID transmission is pretty low. So, I'm not surprised, even if people are following CDC recommendations, for them not to be wearing masks outdoors. Now, I will say that I do still recommend that if you're going indoors or in the public with people who are not within your family or a small group that are all known to be vaccinated, that you wear a mask. I do. I wear a mask to protect myself and as an additional measure when I'm out in public. I think that prudent step is still worthwhile when you're in the public space indoors.
Thank you, Dr. Dobbs. How concerned are you all about the Indian variant now in the US? What do you know about it? How is it different? And also the increase of the UK variant in Mississippi. That's from Tanya Carter at WTVA. Dr. Byers.
Well, certainly we're watching the increase of the UK variant in the state, and that's one of the things we're doing surveillance for. And we've identified well over 300 cases of the UK variant in Mississippi, which is not surprising. We've started looking for it more. Certainly, we knew that our surveillance would pick up the UK variant. It's the most dominant strain in the United States right now. I think being seen most frequently. And specifically about the UK variant, we know that the vaccines that we have now are effective against the variant and can prevent infection and can prevent those long-term complications that can occur and those severe complications that can occur. As far as the Indian variant, we haven't identified it in Mississippi. That's one of those things that our surveillance system is designed to pick up if in fact we were to see an additional variant strain identified. And certainly we put that data on our website each week as well, with an update of the types of variants and the number of variants that we are identifying in the state, and we provide that by county as well, so you can have some awareness of where we're seeing those variant strains.
Do we have any evidence yet, Dr. Byers, that we will have protection from being fully vaccinated against this Indian virus?
I may have to let Dr. Dobbs jump in on that one. I'm not aware that we've seen much.
The only thing I've seen from the international perspective, it looks like the vaccines that they're using in India that are approved, which are different than the ones that we're using, have retained utility. Kind of like with the other variants, what we've seen is, especially for the Pfizer, where they've done a lot of the studies, even for like the South African variant and stuff, it seems to have retained effectiveness. So, we would anticipate, especially for this one, this is one that developed in the context of a massive outbreak, not because it's trying to escape the sort of evolutionary pressures of a vaccine. It's just that they had a ton of cases. And when you have that many cases, you're going to generate a bunch of variants. So, just based on that information, I would anticipate that there would be retained or significantly retained effectiveness, but certainly the science is not there yet, and we'll continue to monitor that.
Thank you, Dr. Dobbs. As the minimum age for vaccine decreases, is the vaccine likely to become compulsory in order to attend a public school? Gentlemen, what is the process for that? How does a vaccine become compulsory to attend a public school?
It's part of our process through the Department of Health. But, I wouldn't anticipate that being likely. We would want to obviously get more information and have public comment period, that sort of thing. So I would just say at this time, we don't see likely us to have compulsory, mandatory coronavirus vaccines really for any age group, right at this moment, and probably not for kids for next year.
Okay, so it looks like, thank you, Dr. Dobbs. It looks like we don't have any more questions. Like I said in the beginning, I wanted to talk about misinformation. I wanted to talk about moving beyond the pandemic and making sure we can set up a vaccination site near you. So Dr. Dobbs, just a few words that you'd like to impart about information and misinformation.
Yeah, no, I just encourage people to make sure that they're getting their information from credible sources. There is a astounding abundance of bad or even false information. Science has gotten us to our modern era, and superstition and fear has held us back. So just please get your information from credible sources. And if something seems fantastic and just too amazing to believe, it's probably too amazing to believe.
Thank you. Dr. Byers, moving past this pandemic, what's the most important thing we should do?
Well, I think that we need to continue to pay attention to the guidelines, pay attention to the most current evidence, and the most current guidelines from CDC, with an understanding that as we get through this process and we vaccinate more people in the United States and vaccinate more people in Mississippi, that those guidelines will be evolving, and we may see some lessening of additional restrictions. But I think it's important to understand that there are some benefits from getting vaccination, apart from the piece that's really important, which is the prevention of infection in yourself and prevention of transmission of that infection. But those things that we talked about, that you can start interacting with fully vaccinated people indoors in smaller groups without having to wear a mask and without having to stay 6 feet away. And I think that that's a sign that the vaccination is working, that we need to continue to roll it out, and that we can start having things look more normal and start engaging back into normal activities, as long as we keep pushing forward. We can't just stop at this point and assume that we're not going to have any other cases or impact. We need to continue to push forward with vaccinations, and I think we'll continue to see our case numbers and our deaths low in the state.
Yeah, we want the momentum to keep going, because the more people that are fully vaccinated, the more likely we can return to, quote, a normal lifestyle. Jim Craig, we've done some great work throughout the state, a lot of creative things. Remind people, we will partner with you. We'll do all sorts of creative partnerships. We partnered with some restaurants last week. So Jim, remind people, please, how can they set up a vaccination site near them?
Yeah, and just remember too that out on our website at healthyms.com, there's a great vaccine finder. If you have people that are just trying to find vaccine and they don't know where to find it, whether it's a health department location or one of our healthcare providers or a pharmacy or other, if there's a vaccine opportunity that we know about, for the most part, a lot of those are out there on that vaccine finder. So it's a great way to locate vaccine. But yes, if you have groups that are interested in putting on or hosting a vaccine event, we're looking to partner. So please let us know. We're happy to arrange a process to get vaccine brought closer to those communities that are ready to be vaccinated. Most important thing though right now is as we visit with folks, please, if they're on the fence about should I get vaccinated or should I wait a little bit longer, now's the time. Let's go ahead and get vaccinated in Mississippi and start getting back to those conversations we were talking about of the future.
Thank you. On behalf of Dr. Dobbs, Dr. Paul Byers, and Mr. Jim Craig, I'm Liz Charlotte, wishing you a good afternoon.
Thank y'all.